In this video, we're going to go over a focused search pattern for making the diagnosis of a basilar thrombus. And specifically, we're going to discuss CT findings, both non-contrast CT findings and CTA findings. The theme here is going to be using both your axial and your coronal images as you trace vessels to help make the diagnosis. Now, we'll start with the non-contrast imaging, and it's important to realize that even though it's a non-contrast study, you are able to actually see the vessels. Like this is the right vert, the left vert. They'll come together here to form the basilar, and it's important to have tracing vessels as part of your search pattern, even on a non-contrast head CT study, because you can make the finding that's being shown here, which is this hyperdense basilar artery. Now, admittedly, this is a very subtle sign. It's not shown, I don't think it's really been studied to the extent to kind of demonstrate its sensitivity and specificity. So it's not like it's the most sensitive or specific finding. However, it can be pretty suggestive that this patient may have a clot here, in the basilar artery. So when you see this, there's a few things you can do. You can definitely put an ROI on here and kind of measure the density. There's not a true cutoff. It more is kind of just a gestalt where you look at it and you say, you know what, that's a lot brighter than I think it should be. And if you look at the MCA isn't quite as bright, which is right here. So, it's kind of out of proportion to the other vessels that you see. And then what you can also do is look on the coronals, and you get a great view of that basilar artery right here, and it is looking very, very bright compared to everything else around it. So this is enough to kind of suggest, you know what, especially in the right clinical context, this patient could be having a basilar artery thrombus, which is causing a stroke. When you see something like this, because it's not very specific, it's important to pick up the phone and call the ordering provider. Hopefully they're still with the patient, and you can get some more clinical context. And really, this finding, if it's present with most any neurologic symptom, it probably warrants getting vessel imaging, like a CTA, and just so you can kind of rule out this devastating diagnosis. Now, that being said, if the patient really doesn't have any neurologic symptoms, there's no clinical concern for stroke, it is always possible that it's just a dense looking vessel and it's not actually a thrombus. But you need to actually make the call and talk to someone who has examined the patient and evaluated them before you can blow something like this off. Similarly, the way to actually make the diagnosis is on post-contrast imaging. And when you have a stroke study like this one, you're going to get a CTA of the head and neck. And whether you trace the vessels from the aortic arch or start at the circle of Willis may depend a little bit upon kind of the flow of your search pattern. But for purposes of this study, what we're going to do is start at the circle of Willis, and really start at the tip of the basilar and go down and trace downward. And really, when you're starting up here, you want to look at the PCAs and you want to look at the basilar tip, the SCAs, if you can see them. And already we're seeing here, this is the basilar artery, the right PCA coming off. The right PCA actually looks okay, but we don't really see contrast going into the left, and then it's almost like half the tip is filled with contrast and half of it is not. This is actually probably retrograde filling, because this basilar is actually completely not opacified. So you can go all the way down and see that it's not filling. The verts that are coming here are not filling. And it's important to be careful, because clot can be, hyperdense like we saw on the non-con. You don't want to be fooled into thinking that there's just, contrast going through here. This is actually an occlusive, large thrombus that's going from the vert all the way through the entire basilar artery to the tip. And similarly, like the non-contrast imaging, you want to use your coronal to really make the diagnosis, because this gives you a really good look of the entire basilar artery, and then you can see how that left PCA comes off not opacified, especially in the proximal component, and then the right PCA is opacified. So this just shows you the extent of the thrombus that is there. So really the bottom line is use your axial and coronal imaging together to trace your vessels in a systematic way, and don't neglect the posterior circulation, and make sure you look throughout the entire basilar artery. This case is not necessarily the most subtle. However, sometimes you'll see the opposite situation where it's just the basilar tip thrombus, and maybe it's just going into a PCA, but the rest of the basilar opacifies, and they sometimes can be very difficult to pick up, especially if you don't look at the coronal.